Hello, and welcome to the North Coast Journal Preview, where we take a look at the stories from this week's North Coast Journal. I'm joined here in the studio with Thad Greenson and Jennifer Fumiko Cahill.
Hi.
Welcome. Thank you for joining us here.
Thanks for having us.
Let's dive right in and hear about what's in this week's edition. Thad, what's on the cover?
Yeah, so this week is our annual health and wellness issue. So it's kind of a themed issue, and a lot of the content focuses on health and wellness issues in Humboldt County. And the cover story in particular is about some stuff going on at Mad River Community Hospital. Most notably, the hospital has had 4 physicians leave or announce their intention to leave in the last couple weeks, which is a big chunk of its staff. And so the cover story is really kind of a profile of one of these physicians, Dr. Kim Ervin, who has been an OBGYN in Humboldt County for 30 years now, and has kind of a cult-like patient following. Her patients adore her. And she left the hospital and wasn't really sure where she was going to go. She left after raising a bunch of concerns internally, she says, about the staffing conditions and the quality of patient care at the hospital. And that led to a number of disagreements with the administration, which led to her contract not being renewed and her leaving. And now she has landed at Open Door Community Health, which apparently thinks highly enough of her that they are starting their own OBGYN clinic as a place for her to land in an effort to keep her in the local community.
So how far into this does this story get? Does it get to the things that maybe the hospital doesn't want people in the community to know about?
I think that's fair to say. The hospital issued a rather scathing statement kind of at the 11th hour, right as we were about to go to press, responding to some of Dr. Ervin's concerns. Not really actually responding to Dr. Ervin's concerns as much as kind of attacking her and saying that she was unprofessional and questioning her honesty about some things. But the story, definitely goes into some of the concerns she says she raised at the hospital and some of the things that she felt were amiss there, or feels like there's still amiss there. I think there's also a lot of room for follow-up reporting. I think this is something we'll be reporting on for some months to come. But as to her concerns, the first kind of issue that she really had there was a high rate of turnover among nursing and supporting staff. Basically, she and other folks at the hospital say that nurses at Mad River get paid on average about $10 less than those at St. Joe's. They're not unionized at Mad River. And so that really makes Mad River Community Hospital kind of a training ground for nurses with high turnover rates. A lot of folks go there as their first job and then move on as soon as they can, which just brings continuity issues and problems with patient care on that front. And then things really started to come to a head from Dr. Ervin's perspective in February of last year when the hospital let go about 12 employees from their clinics. And for Dr. Ervin's OBGYN clinic, that meant losing a receptionist and a medical assistant. From her perspective, this did 2 things. One was it put a much larger burden on the care providers, so the doctors and nurse practitioners, who just had less support. So they had to start doing things like checking in patients themselves, taking blood pressures, which takes time out of their day and means they have less time to spend with other patients. So there was kind of access issues on that front. And then the other thing it did was, especially with the lack of a receptionist, made it really hard for patients to get in touch with the practice and get in touch with the providers, whether it was to schedule an appointment, get medication refilled, or with a post-care follow-up question. And it got so bad, and patients were just not hearing back from the clinic, that Dr. Ervin says she and her colleague, Dr. Hackett, actually started giving out their personal cell phone numbers to all their patients, saying, look, we know you guys need to get in touch with us some way. Here's the way to do it, which, Dr. Ervin has a couple thousand patients. It's not a tenable solution in the long term.
Right.
So that was another big issue. And then it seems like kind of the biggest conflict between Dr. Ervin and the administration came through her role as chief of surgery, which she took over in late 2018. It's kind of a volunteer position within the hospital. The chief of surgery kind of acts as the department head for the surgery department. It's a place they oversee all the surgeons and all the folks with surgical privileges at the hospital, and they kind of serve as the interface between them and administration, and then also between staff and the surgeons. So in this capacity, Dr. Ervin got a request to renew a orthopedic surgeon's privileges, which come up every couple years. And when she looked at it, she realized that this particular surgeon was, his license had been put on probation by the California Medical Board. And that raised a red flag for her. She kind of looked into it, and then because she'd looked into that aspect, she looked at his personnel file with the hospital and found that there were a number of complaints from staff that had worked with him saying that he'd been verbally abusive in the operating room. And so she brought these concerns to administration, saying, I don't think we should renew this surgeon's privileges. And I think her words were, the response was, why are you bothering us with this?
Oh my goodness.
And so she felt so passionately about the issue. After being told to stand down, she actually referred this physician to the Del Norte Medical Society's Physician Wellness Committee, saying that she thought this physician needed help and had anger management issues and had some things that he needed to work through. The administration's response to that, according to Dr. Ervin, was she was sent a cease and desist letter.
Oh my goodness.
She then followed up with the administration saying, I've got a bunch of concerns. I don't, if these aren't addressed, I don't know that I can keep practicing here. And she says that the administration responded saying, are you giving your 60-day notice? And there's kind of this weird back and forth, and they decided that they needed to part ways.
Wow. Well, you mentioned that there were other doctors that left also. Mm-hmm. Was it sort of a solidarity thing, or everyone has their own story, or to be determined?
Everyone has their own story. That Dr. Hackett, who is Dr. Ervin's colleague in the OBGYN clinic, is leaving to be with Dr. Ervin. She's kind of like, I'm with her. I'm in Ervin's camp. Wherever she goes, I want to go. Then there's Dr. Andrew Hooper, who's leaving, also going to Open Door, I think for different reasons. And he's a primary care physician. And then Dr. Mahan, I think, is going to St. Joe's. And I wasn't able to catch up with her for the story.
Wow. So this is interesting, and I'm sure we're going to want to follow up more and hear about how this all plays out with the hospital from their perspective too.
Yeah, certainly. And I think I think the big takeaway is kind of no matter which side you believe or where you fall, there is a lot of turmoil at Mad River right now, which is really a community institution, and I think everybody has a vested interest in it being a successful, stable hospital. So.
Yeah, most definitely. Well, thank you. How about you, Jennifer? What's going on the arts and features beat this week?
Well, in what I like to think of as the creamy middle of the paper, we have, I want to take a moment for Simona Carini appreciation. Simona Carini has been a freelance writer with us for, I think it's a zillion years, I think.
That's fair.
And she's a marvelous, very active, very small and intense woman, and she has written, it turns out, 101 articles for the journal in the way of recipes and food writing. And then there have also been some, what we call our get out column, our sort of outdoor activity or just general getting out of your house and doing something physical column.
She's in the Century Club. I love it.
She is totally in the Century Club.
Well-deserved shout out.
Yes, and she does this while traveling over the world, freelance writing for lots of places, maintaining a food blog. I think, she sends me these emails like, I'll send you this when I'm back from Greenland. She also gets up at, the crack of dawn to go row Humboldt Bay.
Oh my goodness.
Fantastic. So she has two pieces in this week, and she is a great example of somebody who is living well. And her health and wellness contributions to the paper this week include, one, a story about, kind of an essay about why you should take it easy. You should be active, you should do things, but you shouldn't be killing yourself.
Oh, right on. I like this.
For
I like
those
where this is going.
Yeah, for those of us who lived through, like the 90s and the aughts and the early days of Madonna getting those terrifying deltoids, the idea of exercise is something you do until you vomit, until you are a mess, a puddle of sweat. And what Simona has done is she's looked through kind of the U.S. government's, Health and Human Services websites and their recommendations, and this book that they put out about health and physical activity, and they've recommended, like 150 minutes a week of, moderate to, high moderate activity. You don't have to go insane.
Right.
And she also points to the work of another writer, and the idea that you should do the exercise that you enjoy. She somehow, there are many things Simona enjoys that I don't understand, like celery and running.
Okay.
But she has found, running as her thing that she enjoys, among others. And I really like this approach. I appreciate the moderate approach.
Yeah.
And I mean, are we done with these Spartan runs or whatever, where people go running through the mud until they collapse?
I am.
Yeah.
I think they exist, but the idea of moderation is a compelling one, and it reverberates with a lot of people.
Yeah, and we don't leave those runs in humble anyway. We are always running through the mud. She also has a really fantastic, and when I say fantastic, I mean a thing you will actually make. She has a recipe for Swiss chard that is a quickly cooked squeeze of Meyer lemon juice, really simple way to make greens, so that when you have your plan in the supermarket, you go and you buy all these greens, or you're at the farmer's market and you're inspired and you buy it all, and then on Tuesday night you're just like, no, this is not happening. But Simona is here for you, and she's got a way for you to actually eat the greens you bought.
Right on.
You're welcome, everyone.
Yeah, I think we need this.
Yeah, if you see Simona on the street, say thank you.
Yeah.
The other thing that we have in the back of the book, along with a really great set list column, this week Colin Yeo writes about, of course, what to enjoy in terms of live music around the county, but also the death of Neil Peart.
Oh, I know.
I know. Rush fans.
Yeah. Heard a lot of limelight this weekend.
Yeah, and he wrote about that, and it coincided actually with the death of a dear friend of his. And he has some really beautiful things to say about treating each other well and enjoying one another's friendship and being kind to each other while we can. And so
great.
Even if you are not interested in going out this week, even if you are a hardcore introvert, I strongly recommend listening to some Rush and reading Colin's column.
Well, right on.
And then lastly, I have a satirical piece, a seriously column, about a lifestyle brand, sort of like Goop.
Right.
But, and honestly, by the end of it, I feel like maybe I should do it. Maybe I should start it.
Yeah.
But it's based...
You'd make way more money than you're making now.
It's spelled MDVL, and it's
Okay.
medieval, and it's a lifestyle brand in which we go back, and instead of cherry picking from Eastern religion and Ayurvedic Indian practices and Native American culture, instead of cherry picking from those things as wellness sort of cults and brands often do, maybe we should go back to European roots, which have not really been mined for financial gain, like the Middle Ages, like the sort of hygiene practices that led to only a third of Europe dying during the Black Death, and maybe pasteurizing milk isn't all it's cracked up to be, and some other practices like leeches, all those things that we could bring back and monetize heavily.
Oh my goodness.
So please enjoy it, and don't do any of it.
So if you liked Game of Thrones, you'll like to laugh at these ideas.
I think yes. I think if you've been watching the series Witcher and you're like, but how do I get that skin?
Oh my goodness.
Maybe bleeding under a full moon. Maybe that. Yeah.
It needs a soundtrack, but it sounds great.
Please feel free to write me some sick bard rhymes.
All right.
Yeah.
I like this. Well, thank you very much. Is there anything else you guys want to add about this week's issue before we wrap up?
There's a bunch of, I'm biased, but I think there's a bunch of really nice content in there. We have a really nice column from Jen Savage, local freelancer, about just from a successful person's point of view of how stressful healthcare can be. So I think a lot of times healthcare gets written about through the lens of people on the margins and stuff. And this is somebody who's saying, I've got a career that I love, I have a house that I appreciate, I have so much in my life, and yet still healthcare is an enormous stretch and financial drain.
Yeah.
I think it's a valuable perspective.
We're going to have to do Jen Savage appreciation another day.
Yes, we will.
Next week, maybe.
Yeah.
Well, this is great, you guys. Thank you very much. Everybody, go check it out on newsstands now. Pick one up. Stay informed. Thank you, Thad. Thank you, Jennifer. Till
Thanks
next week.
for having
Take care.
Thank you.